This introduction to socio-cultural issues in sport will describe the health benefits of physical activity and the factors which contribute to increased levels of inactivity. We'll then look at possible barriers to regular participation by young people and the recommended amounts of activity needed for health. Physical activity is considered to be an umbrella term. Physical activity is part of every able-bodied person's life and might involve walking upstairs or doing housework. It will include anything that gets the body moving and the heart pumping harder than at rest, but it doesn't have to be really vigorous. We also need to consider physical activity as an umbrella term, which covers physical and outdoor recreation, physical and outdoor education, and sport. We'll examine each of the different types of physical activity from play down to sport later on in the course in different lessons, but for now we can order them based on their level of organisation, from play being low organisation all the way down to sport being highly organised. Health is more than being just free from disease. Health includes having a nutritious diet, getting sufficient rest, having good levels of personal hygiene, and having medical needs met. In addition, a healthy, balanced lifestyle usually includes one or two hobbies or interests, and of course physical exercise. It could be argued that the lives of many in contemporary Britain are out of balance, with high levels of stress, little time to prepare healthy, nutritious food, and difficulty in committing to or sticking to an exercise programme. Exercise is activity that requires physical activity. An individual's physical exercise might be their regular jogging, their walking, swimming, aerobic sessions, cycling, or going to the gym, all of which involve aerobic work using large muscle groups. Importantly, for our definition, exercise is done to improve health and fitness. The benefits of physical activity are well documented. Obesity levels, especially among young people, are at an all-time high, with the number of obese people in England having nearly doubled between 1980 and 2000. Nearly 7 out of 10 men and 6 out of 10 women in the UK are overweight. Participation in regular fixed physical activity, whether it's physical or outdoor recreation, physical or outdoor education or sport, can impact positively on our body, our mind and spirit, thus improving our quality of life. There are numerous physical benefits. People who are physically active have about a 50% reduced risk of coronary heart disease. Some experts believe that lifestyle factors such as physical activity can prevent certain types of cancer. It can preserve bone density, reducing osteoporosis. Physical activity can improve our coordination, our strength, our flexibility and balance, reducing the likelihood of falls and fractures, particularly amongst older people. Blood pressure is likely to be lower. We reduce the risk of stroke, hypertension and blood clotting, and the odds of suffering from insomnia, diabetes and stress are also lessened for the physically active person. Exercise can contribute to a longer life, increase energy levels, and contribute to a healthier national economy by way of reduced health costs. Regular physical activity can also impact on our mental health. It has the capacity to relieve anxiety, depression, and sensitivity to stress. You may have experienced the feeling of being a bit fed up, too worn out to exercise, or that you can't be bothered to go training, particularly after an exhausting day at college. Yet afterwards, and as a direct result of doing some exercise, your mood has improved. There's even some evidence that academic performance might improve due to regular participation in physical activity. The personal benefits are those to do with yourself. Self-control, self-discipline and self-esteem due to achievement can all be heightened and increased through regular participation in physical activity. We can really get to know ourselves, our strengths, weaknesses, likes and dislikes. It's a process called self-realisation. The social benefits involve meeting new people and gaining a feeling of belonging and integration, perhaps through clubs or classes. Wider social benefits can include decreased antisocial behaviour as a result of community recreation schemes. All in all, key benefit of physical activity is it will help us to live longer. And with improved health and fitness, there's going to be less cost to the NHS as people suffer from less chronic or acute diseases such as diabetes or obesity. 7 out of 10 adults in the UK are sufficiently inactive to be classed as sedentary, meaning that they are moderately active for less than one 30-minute period per week. As patterns of inactivity begin in early life, the promotion of physical activity among young people is essential. So why have people become less and less active? In the last 150 years, Britain has changed from a rural, people living in the countryside, to an urban society, people moving to towns and cities. People have therefore moved from more manual work to those jobs where they tend to be desk-bound and obviously less active. Rather than working hard out in the fields, people now tend to sit at desks looking at computer screens. Cars are the most obvious example of new technology that's reduced exercise, with fewer people walking or cycling to work, to school or college, or just into town to go shopping. But other forms of modern technology, such as lifts and escalators, washing machines, sit-on mowers, and even TV remote controls have also had an impact on the amount of physical activity that people do. If we add to this the hours spent in front of TV and computer, including shopping online, with many young children, rather than going out and playing sport, playing computer games while sat down, this has led to increased sedentary lifestyles. The recommended amounts of physical activity state that adults should do a minimum of 30 minutes of moderate intense physical activity 5 times per week. Children and young people should do 60 minutes of moderately intensive physical activity each day. At least 2 sessions should include higher impact activities to improve bone health, muscle strength and flexibility. Moderate intensity is when you're able to hold a conversation during exercise, feel a bit breathless, but back to normal within 10 minutes of stopping. This time could be made up of 10-minute chunks over the course of the day. Any type of activity that's safe, enjoyable, and that gets the heart and lungs working is suitable. So what are the barriers that prevent young people from taking part in physical activity? Young people complain of a lack of energy. A hard day at school or college means they don't have the energy required to go out and play sport. Some young people perceive their ability as lacking. They don't have the skills to take part in sports such as team games. It might be that they surround themselves with friends who are also inactive, friends who will quite happily sit and play on the Xbox or the PS3 rather than go out and play sport. It could be that there aren't suitable facilities nearby. Some young people don't have the ability to get transport to sports centres or playing fields, which will affect their ability to take part. Money can also be a barrier to participation. Gym memberships are expensive. It costs money to go swimming, it costs money to hire a tennis court or to join a fitness club. There's also pressure to wear the appropriate kit, to look good, to have the latest trainers or tracksuit, which can also provide a barrier to children and young people. Particularly in the winter, there can be anxieties about going out and taking part in sport when it gets dark. When the days are shorter, it reduces the amount of time available to take part in sport. The weather in this country can also be a factor, whether it's snow or wind or rain. Sometimes the weather isn't great and it's not nice to go out knowing that you're going to end up getting cold or wet. Some people might be embarrassed by their body shape. Or it might simply be a dislike of exercise, the thought of getting tired and having to sweat. In brief, the barriers break down to lack of opportunity, which is the chance to take part in physical activity, which can be affected by such factors as money or time. The second factor is provision. This is the availability of facilities and coaches. And finally, esteem. This is having the confidence, the self-confidence to take part in physical activity.